Hi everybody, Kelly Ryan here. For those of you who don't know me, I'm a registered holistic nutritionist. And today I would like to talk about vitamin D. So, vitamin D is probably something you've heard a good bit about lately. I myself talk about vitamin D a good bit. I think it's a very important vitamin to get. And the question is are you getting enough? So vitamin D is an essential fat-soluble vitamin. What does this mean? Basically, it means you don't make it on your own in the body. It's best taken with fatty foods, with fats. That's how it's absorbed the most. And it also stays with you longer. So with water-soluble vitamins, you tend to pee them out if you have too much. With fat-soluble vitamins, you don't. You store it. So vitamin D is also sometimes called the sunshine vitamin because basically our skin makes it when it's exposed to sun. A lot of people think you get it from the sun. That's not quite true. What it is it's basically a reaction that you get when the sun hits our skin. It activates it. So, did you know that vitamin D deficiency is probably the most common nutrient deficiency? And a little fun fact, it's also the vitamin that has more scientific articles published since 2000 than any other vitamin. Like most vitamins, vitamin D has many functions in the body. It's mostly known for its ability to help build strong bones, but vitamin D is also important for a healthy immune system, digestive system, heart and mental health, blood sugar regulation, and resistance to cancer. So, vitamin D in the body. Vitamin D actually acts like a hormone. So that means it's produced in one part of the body, so your skin, and travels through to act on another part of your body, such as your bones. Like I said, vitamin D is fat soluble. When you have more than enough, it gets stored in the liver, and it isn't flushed out in your pee like some other vitamins are. Another fun fact, fish liver oil contains vitamin D, but not fish oil. It's the liver that stores the vitamin D. So just like people, fish liver is also where vitamin D is stored. So, how about your bones? Vitamin D is most known for its importance to bone health. Bones are alive and are constantly remodeling themselves. So that means that they, like other tissues, need a constant supply of nutrients. And how does vitamin D help your bones? Well, vitamin D helps your body to absorb calcium more efficiently. And calcium is one of the major players to help mineralize and strengthen our bones. So basically, vitamin D and calcium work very well together. Vitamin D works with other hormones to ensure optimum levels of calcium are in the blood. And when it comes to calcium, the body always prioritizes the blood over the bones. That's because your blood actually needs calcium. Most people think it's only your bones that need calcium, but it's your blood too. And it needs it in the body for important functions like heart contractions and muscle contractions. And that's why it's important to maintain the calcium levels in your blood over levels in the bone. When there's enough calcium in the blood, any excess is stored in the bones, which helps the bones to mineralize and strengthen. When there isn't enough calcium in the blood, the body does something interesting to help raise the level. First, vitamin D, which is stored in the liver, is activated to help absorb more calcium from food. Second, the body removes calcium stored in the bones to raise levels in the blood. When we don't get enough vitamin D and calcium regularly, bones can become weak and brittle. In children, severe vitamin D deficiency can cause rickets, and in adults, it can cause osteomalacia. With less severe vitamin D or calcium insufficiency, as opposed to a more severe deficiency, osteoporosis can develop over time. Having enough vitamin D in the blood is associated with higher bone density. Studies show that supplementing with vitamin D may actually reduce the risk of falls and bone fractures. So a lot of times you'll see people supplementing with calcium, but it's also good to supplement with vitamin D as well. Now, having said that, you want to make sure you're not getting too much vitamin D because, like I said, it's stored in your liver when you have excess. So you do want to make sure you're not getting too much. If you're wondering about your vitamin D levels, it's always good to talk to your doctor and see if you can get it checked through a blood test. So several studies have shown a link between low levels of vitamin D and immune-related conditions like atopic dermatitis and rheumatoid arthritis. In the lab, vitamin D seems to have an anti-inflammatory and antioxidant properties. So I know I've talked about inflammation in the past, but a fun fact is that inflammation is mostly caused by the response of our immune system. Vitamin D can reduce the immune response and inflammatory markers. Some studies in people with immune conditions, such as cystic fibrosis, multiple sclerosis, and obesity, show that supplementing with vitamin D reduces some inflammatory markers in the blood, although not all studies agree with this. Some researchers link vitamin D due to its effect on the immune system. Some researchers think vitamin D, due to its effect on the immune system, may also help with serious food allergies. A few small studies have shown that with low vitamin D levels, there's an increased risk for food allergies, but more research is needed on this. So since vitamin D is fat soluble, it's absorbed along with fat in the diet, as I said before. So people who don't eat or absorb enough fat are at a risk of low vitamin D levels. This can include people with many digestive issues, such as celiac disease, inflammatory bowel disease, Crohn's, colitis, as well as people who have had gastric bypass surgery. Also, a healthy vitamin D status seems to go hand in hand with a healthy gut. And for anybody who knows me, they know that I'm always talking about making sure your gut's in good working order. So, for an example, there's a link between suboptimal vitamin D, gut microbiome status, gut inflammation, and diseases of the gut like irritable bowel syndrome and colon cancer. So it's not just colon cancer that can be associated with low levels of vitamin D. Higher levels of vitamin D are associated with risk for prostate as well as breast cancers. In the lab, cancer cells don't seem to do as well when exposed to higher levels of vitamin D. They don't divide or invade other tissues as well, and they seem to die easier. It's unclear, though, whether supplementing with vitamin D would reduce the risks of cancer in people. So, vitamin D and heart health. Several studies have linked low levels of vitamin D in the blood with heart disease. Higher levels of vitamin D in the blood may reduce blood pressure and the risk of heart disease by a small amount. Supplementing with vitamin D may help lower blood pressure slightly, but the evidence isn't clear on how supplementing affects risk of heart disease. Vitamin D and blood sugar. Low levels of vitamin D are associated with higher levels of insulin resistance in people without diabetes. It may also increase the risk of developing diabetes. Supplementing with vitamin D may help to improve blood sugar management in some people with diabetes. How about vitamin D for mental and brain health? Cells in key areas of the brain have receptors for vitamin D, believe it or not. Vitamin D also has a role in the circadian rhythm and sleep. It affects the growth of nerve cells and impacts the developing brain. There's growing evidence of the link between low levels of vitamin D and symptoms of depression. Some studies have also shown a link between low vitamin D levels and an increased risk of Alzheimer's and Parkinson's disease. So what forms can you find vitamin D in? Many vitamins come in more than one form. With vitamin D, it comes in two different forms, D2 and D3. Vitamin D2 is the plant-based form, and vitamin D3 is the animal form. At higher doses, however, vitamin D seems to be less potent than vitamin D2 is less potent than vitamin D3. And so where do you get vitamin D? There are three main sources: sun exposure, food, and supplements. So for sun exposure, our skin contains pre-vitamin D, and when it's exposed to UV rays from the sun, the pre-vitamin is converted into vitamin D. In fact, vitamin D levels decline in people throughout the winter, which makes sense, and especially if you live somewhere like where I'm from a small island on the east coast of Canada where we don't get a whole lot of sun. We see a lot of fog and we see a lot of rain. And so vitamin D is definitely in short order here, especially during our winter months. So let's look at how to get vitamin D from food and supplements. So vitamin D is not naturally found in a lot of foods. It's the best source is actually from the sun. So I would suggest, 20 minutes a day of good quality sun where you're not completely covered up. And then after that, go on with your regular sun health routines. So for food, the best sources include fatty fish and fish liver oils. Some is also found in beef liver, some cheeses, and egg yolks. And these would be the D3 form because they're all animal form. Naturally occurring plant sources, which is D2, are in some mushrooms that have been exposed to sun, but that's really about it. So, fun fact, because vitamin D is fat soluble, absorption from food, drinks, and supplements is improved when taking it at the same time as a fat-containing meal. So how about supplements? If you're at risk for a vitamin D deficiency, your healthcare provider can test your blood for levels of vitamin D and recommend a course of action specific for you. If you don't have a professional recommendation for how much vitamin D to take, the safest way to supplement is to follow the instructions on the label. You can never take more than 4,000 IUs a day unless told by your licensed healthcare provider. And the reason is too much vitamin D could potentially be toxic. One effect of too much vitamin D is that blood levels of calcium can get too high. This can lead to calcification, which can damage blood vessels, the heart, and kidneys. So getting too much vitamin D is mostly at risk when taking supplements, not so much from sun exposure or food intake. And don't forget to check with your doctor or pharmacist if you're taking medications or your naturopath, because vitamin D supplements can interact with some of them. Fun fact, supplementing with vitamin D has not been consistently shown to correct many of the conditions listed above, except for rickets and osteomalacia. Some studies show improvements while others don't. While these conditions are associated with low blood levels of vitamin D, they may not always be improved with supplements. So studies show that between 30 and 80% of people simply just don't get enough vitamin D. This deficiency is so common that researchers have called it a public health concern and a global problem. Vitamin D deficiencies can happen when, over time, people are not getting enough safe sun exposure or not eating enough foods containing vitamin D. It can also happen if the vitamin D is not being properly absorbed very well. or if the kidneys have trouble converting the pre-vitamin D into the active form. People who are likely to be deficient in vitamin D include pregnant and lactating women and breastfed infants, older adults, people with limited sun exposure, people with darker skin, people with digestion issues that prevent proper absorption, people with obesity, and people who have undergone gastric bypass surgery. So one big question is, how much vitamin D do we need every day? For adequate blood levels, to get enough vitamin D from the sun, a general rule, as I said before, is to get about 20 minutes, now 5 to 30, depending, but generally 20 minutes of sun between 10 a.m. and 3 p.m., at least twice a week, to the face, arms, legs, and back, without sunscreen. So, just to summarize, vitamin D has many health-promoting roles in the body. Most of the evidence is for bone health, but it's also associated with a healthy immune system, digestive system, heart and mental health, blood sugar regulation, fertility, and resistance to cancer. Vitamin D is also the most common deficiency. We can get vitamin D from sun exposure, some foods, and supplements. And the best way to know how much vitamin D is to have your blood tested if you're at risk. If you don't have a test or professional recommendation, follow the label directions on your vitamin D supplements can be a safe way to get enough. That's all there is that I have this evening. If you have any questions or would like to get some more information, I would love it if you would reach out to me. You can click on one of the links in my contact me page and make sure you reach out to me. If you find the blogs and information that I put out interesting or know somebody who could benefit from it, please feel free to forward it to them. I would love to make sure to get the information to anybody who needs it. That's it for me this evening. And if there's anything that I can help you with, if you're interested in working with me, then please feel free to reach out to me or check my calendar and we can set up a free strategy call. Have a good evening and take care. Stay healthy.